Welcome to a new episode of Get Back to Your Life. And today we are talking about recovery. And what if recovery from surgery was as simple as oxygen? And we've got a contraption that we're going to talk about that delivers that kind of oxygen. We are at VSI on location with Dr. Christopher Good, president of VSI, spine surgeon here at VSI. And we're exploring this really exciting breakthrough about how oxygen can really help you in your recovery. It's kind of become a buzzword, hasn't it?
For sure, and I think what's interesting is a lot of what we've done with recovery actually dates back to myself and one of our other surgeons and the surgeries and procedures we've had ourselves.
Yeah.
And when we go through these, we see, oh, this could have been optimized. This should have been sooner. Why didn't we do that? And so a lot of what we're doing now kind of dates back to that. And the hyperbaric chamber and what we're doing now, really trying to like revolutionize our way of thinking about recovery, actually goes back to a regenerative medicine, a stem cell procedure I had. And I thought I did a lot of things right, but once I got to the end, I said, gosh, I should have done this. I wish I'd have done that. I didn't know this. And so we're trying to roll all that out now so that we're really refining that for people as they're recovering from different types of procedures.
And I know you call that the recovery revolution, and we'll get to that in just a second. But first, I want to talk about what is sitting behind us, because there's a little bit of a sci-fi thing going on here. It almost looks like a submarine. What is this hyperbaric chamber? Tell me what we're looking at and what it does.
Sure. So hyperbaric oxygen has been around for a long time. The goal is to breathe a lot of oxygen and basically deliver more oxygen to our tissues. Okay. Now, a lot of the uses in medicine over time have been for really sick people with really bad problems, people who are losing limbs and gangrene, and bringing these people back from the brink. But the reality is we can use better oxygen to tissues in much more kind of standard situations. So what we're doing is the hyperbaric chamber is a pressurized chamber. So when you go in, you're breathing pure oxygen, but it's actually under elevated pressure. So normally, if we're standing at sea level, we're at 1 atmospheric pressure, okay? And that's just the normal pressure of the gases around us. What we're doing with the chamber is actually increasing that amount of pressure. And with the chamber we've chosen, it actually goes to double atmospheric pressure. So we call that 2 ATA.
And that's like going 3 feet below water?
Well, it's actually double normal atmospheric pressure.
Okay.
If we think about the way oxygen goes through our bloodstream, oxygen is usually carried in our bloodstream on what we call hemoglobin. It's like the taxi cab that carries oxygen. But most of us pretty much live our lives with our hemoglobin totally full of oxygen, right? So you go to the doctor, they check your oxygen level, it's like 96, 98%. So there's not much additional oxygen you can carry. And so if you put oxygen on your nose or breathe oxygen, you can get up to 100%, but like it's already maximal. When we go in a hyperbaric chamber and it increases the pressure, it actually drives oxygen into the plasma, the fluid of our blood. And so now we're delivering oxygen in a whole new way. And that can allow us to get our oxygen level to like 400%, like 4 times as much oxygen delivered to our tissues.
Can you put it in perspective? So what are we breathing normally? What percentage of oxygen, and what does it go to when you're in the chamber?
Sure. Well, normal room air is like 21% oxygen, and then the remaining percent are some other, air molecules. When we go in the chamber, and there are different kinds of chambers, the chamber we're using, you're actually breathing almost 100% oxygen through a face mask. And so you're breathing that in directly. But then with the increased pressure, that's really what drives the oxygen levels into the plasma and gets us the benefit. And chambers come in different settings. Like the smallest chamber would be like 1.5 times atmospheric pressure. The reason we chose two times is it's like a very robust number, but it's also got a really good safety profile. They do have chambers that go up as much as 3 times, where you're fully surrounded by pure oxygen. But you have to be a lot more cautious with those really high power chambers in terms of the percentage of oxygen and the possibility of getting into complications. Because when you do get an increased pressure around, you have to pop your ears, and too much pressure can have some risks. So we think this is kind of the perfect use for like orthopedic and spine type of applications.
And I do want to get to the safety piece, but first, how do you envision this as part of this recovery revolution that you're bringing to VSI?
Sure. So if you think about a lot of the medical conditions that cause bad problems, it's because we're not getting oxygen to tissues, right? People who smoke, it kills little blood vessels and they don't nourish their body, and you get wrinkles, premature aging, and you get all kinds of orthopedic problems and arthritis. Diabetes, right? And one big part of diabetes is you lose little blood vessels that nourish your body and you get all these complications. And so we're using the hyperbaric to try and improve healing in these areas. So if somebody has an injury, all right, using hyperbaric to deliver more oxygen to their tissues can help them improve their injury. If we're talking about like a surgical procedure, if we have a surgery, we have an incision we're trying to heal, we have muscles we're trying to heal, we have inflammation we're trying to combat, and in a lot of our patients we may have some type of implant we're putting in where we want bones to heal, 2 implants, or we want fusions to heal. So anything we can do to improve the biologic environment can help with that healing.
So what kind of improvements are you seeing among your patients? And, you know, it's kind of some success stories that you've experienced.
Sure. Well, what's interesting is, and I've spent a good deal of time in there myself, there is some interesting, you know, as a spine surgeon, I'm always thinking about nerves and nerve recovery. And there's some interesting kind of early work looking at people with really bad spinal cord injuries or different types of hyperactive nerve problems and actually seeing some improvement neurologically. So I've spent a lot of time in there because of that interest. But even if you just think of a relatively straightforward surgical procedure, if I have someone who maybe is carrying a little bit too much weight around, they have some risk factors for maybe getting an infection, getting them in the hyperbaric chamber before and after surgery, I'm seeing these people's wounds like seal up like gangbusters. And so that's a really, really amazing benefit. And I think that even somebody who's really healthy and has a great chance of success, we can increase their chances of success even more. And that really drives me. Like, thankfully, a lot of our patients already have really great chances of success with whatever we're doing. But every percentage point I can increase that, I want to go for that. And so the technology shines the most in people with higher risk, and those are the people I definitely want in there. But really, even for somebody who's in great health and takes good care of themselves and does everything right, you know, we want to do everything we can to optimize those chances.
And you talked about how you've been using it just, you know, as to have the experience. What does it feel like for somebody who's interested but maybe feel a little skittish? What does it feel like? Do you come out feeling refreshed? Do you come out feeling tired?
So I've heard different things from different people. Personally, like when you're in there and the pressure is just going up and just coming down, like you go in the chamber and it slowly starts increasing the pressure over around 10 minutes. You feel like your ears are popping a lot, you know, you have to yawn, just like a plane that's going up and down pretty quickly. Once you're at a steady state in terms of your pressure, I don't really feel that different sitting in there during the treatment really at all. It's really just during the times where it's changing. Now what's interesting is when the pressure is decreasing at the end, actually you feel really chilly. Because there's actually like this, you know, physics relationship for those of you who think, but like there's a relationship between pressure and temperature. So as you're depressurizing the chamber, you do feel like this sudden chill even though the temperature hasn't changed in there. Now afterward, I tend to feel like a burst of like energy. And so if I go to a meeting with my team, like they'll tend to find that I'm like really talking fast, or like I'm a little bit less patient to let everybody finish, because I really have that. But what was the biggest interesting thing to me is I really, as you know, I'm a big proponent of like all around health and sleep, and in tracking my sleep the day after I do the hyperbaric chamber, or my sleep when I'm using the hyperbaric chamber a couple times a week, I really get a much better sleep after that, which is not something that's had a lot of data published or focused. But
do you
it's really
have any
exciting.
sense why?
Well, I mean, we know that oxygen is good for your body. It's good for your brain. And so like, I don't have a study, but delivering more oxygen to my body, it tends to respond in that way.
Mm-hmm. How do you see this changing the experience for your patients who come to VSI?
Well, I think, and this is still the standard of what's out there, people have an injury or they have a procedure, and then lots of times, like let's say you have a procedure, a surgery, you might have 2 weeks where you're at home and you're kind of taking some medicines, and then you get in to see the doctor, and then at 2 weeks they're like, okay, let's start getting you in PT and doing exercise, and like there's this real like big lag time there. you know? And then the patient's like, well, now I want to get in PT. It takes me a while to get it scheduled and get it up to speed. Like, I want to program all that out before. If I know the patient, I know their surgery, I know day 5, this is optimal, day 6, this is optimal. I want to plan out their whole recovery ahead of time, proactively. And that's a big lesson I learned just from recovering myself, is like how much better I could have felt faster if I had all these things scheduled. So really, you know, we plan surgery, we plan all the details of the surgery, we plan the medical clearance, we plan all the technical things we're going to need during surgery. We want to be planning every step of the recovery as much as we can ahead of time, so patients can understand all that.
Yeah, and talk to me about why that's so important, because it seems like it's kind of a forgotten piece. You have your surgery, you go home, the doctor may call you, but you don't have that, you know, touch point that continues after surgery. Why is that so important?
It's so important because the time we can help patients the most is during those early time periods, right? Like, when do you feel worst after surgery? The first 2 weeks. Right? And if you get in with a really great therapist, and they, depending on what you need, but they treat you with the infrared laser, they treat you with massage, we get you doing some light exercise to release endorphins in your body. You know, there's a lot of things, dry needling, there's a lot of techniques that we can use really early on to make a huge difference. And if we're not planning that ahead of time, if we're just waiting till the first post-operative visit and then getting it scheduled, we're missing this key opportunity to improve how people feel, right? And when people think about, especially surgery or having a stem cell procedure, the number of questions is like, how much is it going to hurt?
Yeah.
Right? And anything we can do to modulate and improve that early on, getting expert hands, you know, involved, it makes a huge deal for patients.
For somebody who's listening who may be considering spine surgery, at what point do they need to be asking about this? And should they ask about oxygen therapy?
Well, I think absolutely. And I think you're like, okay, do I need surgery? What surgery? Why? What are the details? But once you've decided, okay, this is what I want to do, you know, I think it's too, you know, at this point, you know, doctors are in a hurry, they've run out of time. And so you really want to say, well, wait, what is not only the risk and the details of the surgery, but what is the early recovery? What is the ideal routine? I want to be thinking, if I need PT, let's get that scheduled ahead of time. Or if I need authorization, or if I need medicines, like what are those going to look like? How do we get those authorized? From a hyperbaric perspective, going in the chamber before a procedure, whether it's a stem cell regenerative procedure or a surgery, has a lot of benefits. So in my perfect world, I'm trying to get my patients in at least once or twice in that week before surgery. And then as soon as they're ready, depending on what we're doing to them, to be back, I want them back in. And so, you know, now I can think of this patient who had a wool neville fusion. 5 days after her surgery, she's here. Right? She's in hyperbaric, she's working with a therapist, she's getting in an aquatic treadmill, you know, and if you look at it, we got almost, you know, 10 or 14 days of like important beneficial treatments in before the first, you know, post-operative visit, which is when a lot of doctors, you know, kind of get around to scheduling those things, you know?
Yeah, there's also a lot of buzz about oxygen when it comes to longevity. Does it meet what's the reality versus the hype here?
Yeah, so I think there are so many medical situations where having good oxygen is critical that it's really easy to extrapolate a lot of potential benefits from hyperbaric, okay? Now, if the longevity space that's gotten a lot of attention on some very prominent podcasts about maybe helping you live longer and longevity. What I will say is, you know, the mitochondria is an organelle, it's in our cells, but they call it the powerhouse of our cells. It's where, you know, sugar and fat is being converted into oxygen, okay? And into energy, ATP. And so having oxygen there is super important. And there's a lot of data to say hyperbaric oxygen helps the mitochondria in this process of making energy, right? And so it's intuitive, like there's a lot of reasons I would think that's great for me. Mitochondria are also involved with things like signaling molecules of the rest of your body, and a really important process where your body actually programs when a given cell is meant to die. And in our body, cells are always being born and dying. And having a cell go away before it develops disease is an important thing for our bodies. And stimulating the mitochondria can be good for that. We also know that our DNA is like the genetic code, And every time our cells replicate, our DNA has to go through this process. There are protective ends of the DNA called telomeres, getting tons of attention in the longevity space. And what happens is each time your DNA replicates, your telomeres get a little shorter. So telomere length seems to correlate with age and health and longevity. And if you lose the caps that are protecting your genetic code, you potentially not only worry about getting old and passing away, but you worry about genetic problems that could come up. And when cells get out of whack, that can be, cancer.
Okay.
And so hyperbaric oxygen seems to be one thing that we can do to actually protect and lengthen potentially people's telomeres.
Okay.
And so the longevity folks, and I'm doing a lot of this for myself, you're like, okay, I'm in there, I feel great, I sleep better, I'm helping my mitochondria make more energy, signal the rest of my body, perhaps I'm actually protecting my telomere length. There's a lot of long-term benefits to the hyperbaric, and it started to get a lot of attention. In the past, I remember when I was a kid, my grandpa almost cut his thumb off and he almost lost it. And then hyperbaric was a miracle, it saved it. Well, historically, that was what hyperbaric was. Really sick people with trying to prevent an amputation or infections that nobody's been able to cure. That's when you do hyperbaric. And it's still used in tertiary care centers for those really complicated things. But if you look at it, not many places like us, we mainly are taking care of elective orthopedic things, very high level motivated patients. It hasn't been used in that patient population before, but anything we can do to get enhanced success for people makes sense.
Sure, of course. Let's talk about the safety aspects of this. What are the risks? Are there any people who shouldn't be using this?
Sure. Well, so we always think about the concentration of oxygen inside a chamber, and oxygen obviously could be flammable. So with pure oxygen, high pressure chambers, it's really critical. No electronic devices, nothing that could cause a spark. And there have been some news stories out there of people who've had fires in their chambers. Now with a chamber like ours, where we're not filling it with free flowing oxygen, it's a much lesser environment, but we've still decided for us, just better safe than sorry, no question. So we don't do electronics or anything inside the chamber. Now, there are some people who shouldn't go in. If you're super claustrophobic and you don't want to do it, you shouldn't do it. When we go in the chamber, it takes about 10 minutes to get up to pressure. And if we want to get out, ideally we take about 10 minutes to depressurize. If we needed to get out in a big hurry and we depressurized quickly, that could cause damage to your inner ear or your eardrums if you really had to go too fast. And so we'd rather be in a situation where if there's any question, let's not even, take that issue. There are some medicines that you're on. They're mainly chemotherapy medicines, but there's a medicine that people take to prevent drinking or decrease drinking, disulfiram. That's a medicine you can't be on with the chamber. So we do have a screening list we always go through for people. And especially for us, if somebody has really bad lung problems, or if they're having seizures all the time, or anything that could be an issue where they're in the chamber and they may need immediate medical attention, those people could still get hyperbaric, but that's not something we're taking on because we just want to be, 100% safe with what we're doing.
And you're in there for an hour.
Yes.
You can go to sleep, meditate.
Yeah, so there's a chair with a recliner, and then there's a flat bench you can lay down on. When I first started going in, I was trying to maximize every minute in there, doing work and writing notes or journaling. But I have to tell you, more recently, I've started to turn on, I've got a documentary I'm watching on the entire history of Europe and Ukraine and whatever. So there is a TV in there. We don't allow people bring their own electronics in, but there is a TV in there. So I find it to be really kind of the most peaceful time of my entire day.
You can just close the door and not let anybody bug you. Yeah. So the TV is okay.
The TV's in there, yeah, that's installed by the company. Okay. There's a heater, there's an air conditioner in there so that you can control that. So it's very comfortable in there, and it's big, right? It's meant, we don't usually have multiple people want to go in there at once, because what are the chances there's another person you want to spend an hour with? Yeah. But it's spacious enough for 2 or 3 people to be in there.
Yeah. This is not common for a clinic like yours to have a hyperbaric chamber. Why did you make the move? I know it was, you're building this recovery revolution, but this is one of the first big tools that you have, in addition to the water treadmill. What else are you looking to bring in? And again, like, why was this so important to you?
So I think when you look at recovery and you look at what our physical therapists and athletic trainers are doing, like, they have so much technical expertise, right? It's their brains and their hands that are super important. But with spine, there are a lot of different technologies that can make us better, right? And so if I can take a wonderful therapist and give them even better tools, I want to. So things like Class 4 lasers and shockwave devices and aquatic treadmill and dry needling, and there are a number of different modalities that we've brought in. They don't replace a great therapist, but they can make a great therapist even better. To me, the hyperbaric chamber is just another piece of that, right? If we can take a pretty healthy patient and then make them even healthier or more likely to recover, there's a tremendous amount of benefit to that. And so it's like anything that is data driven that we can do to get better outcomes for our patients, like, I want to consider incorporating that.
And you really have been on the forefront of a lot of these medical advances. One of the first to do robotic surgery here in the DMV. This is probably one of the first. Do you know?
Yeah, I don't know of another like spine or orthopedic practice like ours that has chosen to do this, right?
So
most of the hyperbaric chambers that are in use are, I believe, like lower power chambers at more like a wellness spa, or really powerful chambers at like big universities where they're focusing on treating gangrene of the legs and amputations and things. So it's very unique to have it in a center like ours. And, it does require some space and some dedication. We've invested to make this happen, and it's a lot of time educating patients about it. But I find that it's really great. It's been having the hyperbaric chamber, which people are really pretty interested in. It's a great way to start the discussion about recovery in general. Yes. And I also think for a lot of patients, we are under-exercising, under-rehabbing ourselves, right? Like, if I really want to get huge, I'm not gonna go to the gym one day a week, right? I'm gonna invest more time and effort into that. And so it's a great way to start planning out for people, okay, we're gonna spend a little time on the hyperbaric, here's what we're gonna do on the exercise side, here's the therapy side, here's the modalities that'll work together. And I mean, we have a lot of really motivated patients that are like, wow, like finally I have this whole package and a big plan put together, and they can really get after it.
So what's next?
Right now, we've done a lot. And so
you have.
I very much want to get our system up and running, and I want to get patients kind of using all this. I also want to start to collect some of our data. Like a lot of the data for hyperbaric, like if you look at wound healing in people with very severe like diabetic problems, we know hyperbaric helps their wounds heal better. So if that's the case, I'm sure it helps somebody who's healthier get their wound to heal better. But there's not been a lot of data on patients like ours. And there's not been a lot of data on like elective spine surgery or using it in conjunction with stem cell regenerative medicine injections. And so I think there's a real opportunity here to say, there's a lot of data that shows this works. We know that it works, and we know it works in the most severe, dire of circumstances. But there's a lot of opportunity for us to say, hey, like this can get really, really great outcomes when used in a little bit more of a standard medical practice.
It's very exciting.
Totally.
Yeah. All right, so a patient is coming to you for a spine surgery, and walk me through what would the process be, and are they doing prehab in this? Then they come to see you for the consultation and the surgery, and then they come after? Walk me through that process.
Sure, so the majority of people are ideally either doing guided exercises on their own if they know what they're doing, or they're working with a therapist going into surgery. The better shape we're in going in, the better the recovery is going to be. So in a perfect world, you have a trusted, great physical therapist, someone on our team you're already working with. If not, we are now setting people up to have a consultation and evaluation prior to their surgery. So they go in, they meet the therapist, they know what are we dealing with, what is the baseline, what is weak, what is strong. Okay, and when it comes to the hyperbaric, in a perfect world, we'd hit the hyperbaric twice in the week going up to surgery.
Now, why twice?
Well, once or twice.
Okay.
The reality is, the more you use the hyperbaric, the better it works. Okay. And so we're always trying to figure out within the constraints of like, we're all busy and how many hours are there in a day. I really like the idea of getting people in once or twice before the surgery to get that benefit, that preloading. okay? And the reality is most people who are having surgery by a week before are pretty committed to it, and so I can get them in for that. Now, it depends exactly on like how much we're doing surgically, because there's a period of time where, you know, we want to make sure people are not doing too much. But in a perfect world after surgery, you know, we've already planned out like, here's the medicines we're going to do, and if they're using an ice machine or some kind of home modalities, are they needing a brace for a few days? But then we'd have them come in early on and doing hyperbaric oxygen around 10 times after most surgeries is kind of really my goal.
And what does it do for them?
Well, again, the more oxygen you get during these critical periods, the better your healing. So if you think about a surgery, we know right after surgery there's usually some kind of pain, swelling, inflammation. The hyperbaric can help with that. So that's like a great benefit right away, like help me feel better. Yeah. But then in terms of the other critical things that are going on, we're trying to get skin incision, we're trying to get muscles to heal, okay? And then if for many of my patients, they've had some kind of nerve problem, that's why they're having surgery, we're trying to get nerves to heal, okay? And then we're also potentially, if there's some kind of implant involved, we've got bone biology with bone trying to heal to more bone, or bone healing to a disc replacement. So all of these processes are fostered by better oxygen delivery. And so, you know, different parts of the healing process happen at different times, which is why multiple trips in over a period of time makes sense, right? And we know like healing from most injuries, even, you know, you tear a ligament in your ankle, right? It's a 3-month process to go through. Now, what we're trying to do is correlate, okay, if we're gonna spend an hour in the chamber twice a week, how do we correlate that? Early after a surgery, especially a bigger surgery, you may not be able to do a lot physically, but maybe being in the aquatic treadmill, which is an anti-gravity environment to exercise, maybe that's what we want for those first 2 visits. And then once you're healed, then we're getting you on land-based therapy and exercise. And so we're trying to coordinate all these things, and so that people come in, they're doing multiple different things each time they come in to optimize.
Well, I know people will want to know more about this. They can find out more at vsispine.com. And is there anything else you want to add that I didn't ask you?
No, I think that we ought to be talking about this before the procedure, any surgery or any stem cell procedure, and getting this all planned out. And so that's, I think, a big part of the push for doctors and for everybody is like, we really could do way better for our patients by planning this all out ahead of time. And I want to see people schedule their surgery and schedule their recovery all at once.
Yeah, awesome. I love the message. Dr. Christopher Good, VSI spine surgeon and president of VSI, thank you so much for taking the time to explain all of this.
Thank you, Laura.